Hi everybody, so the purpose of this video is just to demonstrate the isolated skills of applying and acquiring a 12 lead for your patients with the Zoll monitors, applying the blood pressure cuff and cycling the blood pressure, and then applying the pulse oximeter to the patient and understanding where all of those readings come in. So we'll get started. On all of our monitors, the diagnostics are on this side of the monitor, and then the therapy components are on this side. So in this video, we're focusing on the left side of the monitor. You're gonna open up the bag here, and some of the monitors are a little bit different. They have maybe multiple compartments here instead of just one big one, but all the stuff is in relatively the same spot. We're gonna turn the monitor on and let it cycle up. And the first thing we'll do is apply a blood pressure cuff. The blood pressure cuff is kept stored with this coiled up neatly inside the side compartment here. The blood pressure cuff will get applied to the patient's arm, preferably with the artery mark somewhere in the vicinity of the antecubital space. You'll have the patient just rest his arm comfortably somewhere. In order to cycle the blood pressure, this little button here is what you need to push. You push that button and it will start doing its job. While that's cycling and waiting for a reading, we're going to pull out the pulse oximeter, make sure that's all untangled. This should be put away neatly, but inevitably they always kind of get wrapped up on themselves. Preferably, we'd like to pick on the hand that that doesn't have the blood pressure cuff on it, the arm that doesn't have the blood pressure cuff on it, and preferably not the index finger, because that tends to have historically the poorest circulation in a patient's hand. So we'll use his middle finger, and then he can just rest that arm down as well. So that's a good blood pressure, and we are now picking up a heart rate over here, and then an oxygen saturation over here as well. Next thing we'll do is apply the 4 lead. We keep a set of electrodes, both a 4-pack and a 6-pack, on this side in all of the monitors. If you need extras, we keep extras up above here, and then there's some in other locations and other ambulances as well. So for the 4 lead, we're going to open up the 4-pack. Can we pause? All right, so our 4 lead is labeled. All of our 4 leads and 12 leads are labeled. So I didn't put them on in order here, but we have the right leg, the right arm, the left arm, and the left leg. Positioning of these will be covered in another video if necessary. So make sure that you're applying it to patient's left and right. A little chilly. All right, now that we have the limb leads applied, we can see that this will default on all of our monitors to lead 2 when we put that on, and that's one of the best leads to get a decent rhythm interpretation going and figure out what your rate is and stuff. The 12 lead cables are kept tucked in here as well. So we're going to open up the 6-pack of electrodes and do the same process. I'll pause it. So now that we have the electrodes applied, we need to make sure we remember to plug in the 12 lead connector, V-lead connector. So that's just, it will only plug in one way. Once that's on, you then should try to set this somewhere where it'll not move too much, whether that's just kind of draped over the patient's arm, or under them, over the guardrail, on their lap, however you have the monitor positioned, whatever's going to work best. Also be aware that if you're bumping it going down the road, or if your leg's hitting against it, that's also potentially a source of the artifact. Now that we have that applied, we're going to acquire our 12 lead. So if our camera lady zooms in on the screen here, we're going to select the 12 lead button here, But just in case you're on this menu here, you just need to hit the back arrow to get back to that other menu. So we're going to hit 12, and then you're going to get a dynamic view that pulls up here. You're going to hit the little camera button. It's the top button here with the little 12 underneath it. Camera, you would enter in the patient's correct age. We'll just leave it at 45 for right now. We're going to scroll down to patient sex. You'd select the appropriate sex. Once you've done that, you're going to continue to scroll down with these buttons here. And when you hit that back arrow, it's going to start acquiring that 12 lead. So we're going to use the select button here. You should coach your patient to stay as still as possible and just breathe normally. In a semi-Fowler's position is one of the best ones to try to acquire these, and will lend itself to the best image. So now that it's done acquiring and is saving that snapshot, you can tell the patient if they need to move or cough or get adjusted, they can do that. The last thing we're going to cover in this video is how to transmit that 12 lead. So you've acquired a 12 lead, and now perhaps based on, pause. Sorry about the lights going out. We're back at it now. We were talking about transmission of the 12 lead that we just acquired. So if you look over here on the side of the monitor, there's a little 12 in an envelope. So you're going to select that, and then you'll simply scroll using the scroll buttons here and select whichever hospital you want to transmit to. Once you've selected that hospital, I'm just going to select the training one because we don't really need to send this to anywhere. But once you've selected the correct hospital, you'll use the select button here and you'll press that, and then you're going to come down to transmit by using these buttons again and transmit. And then that's going to go ahead and transmit to the appropriate facility. You do have to have the iPad on so that the cell signal will work, because that's how this connects to the cell service.